My name is Jen Ballard-Hernandez, and I'm a cardiology nurse practitioner at the Tibor Rubin VA in Long Beach, California. I'm excited to be able to share this Clot Chronicle for the North American Thrombosis Forum, discussing some of the key late-breaking science presented at the recent American College of Cardiology meeting, April 2nd through 4th in Washington, D.C. Thousands of cardiovascular professionals from around the world came together for the first time in over 2 years to discuss practice-changing science and innovations. The excitement in the air was palpable and reaffirmed the importance of in-person learning and connections with colleagues. The first trial I'll be reviewing is the POISE-3 trial. Perioperative bleeding is a common complication in patients undergoing non-cardiac surgery. Research into ways to improve vascular outcomes in patients undergoing non-cardiac surgery has shown that both thrombotic issues and bleeding are important. Tranexamic acid, or TXA, is an antifibrinolytic drug that may safely decrease such bleeding. The question the investigators posed: in patients undergoing non-cardiac surgery who are at risk for bleeding and vascular events, does TXA reduce the occurrence of life-threatening, major, and critical organ bleeding? They also looked at, is TXA non-inferior for occurrence of major vascular complications within 30 days compared to placebo? The design of the study was that it was conducted at 114 centers in 22 countries, enrolling over 9,535 patients who were undergoing non-cardiac surgery and deemed to be at risk for bleeding and vascular events. So let's talk about the outcomes. In the current analysis, administration of TXA given as a 1 gram IV bolus at the start and end of surgery reduced the risk of composite bleeding events, as well as a wide range of other bleeding outcomes, including bleeding independently associated with mortality after non-cardiac surgery, major bleeding, and transfusion of packed red blood cells. There were no significant differences between TXA and the placebo groups for life-threatening bleeding or critical organ bleeding. The non-inferiority of TXA versus placebo was not well established for this outcome, but there were no significant differences seen between trial arms for a variety of vascular outcomes, including MIMS, which is myocardial injury after non-cardiac surgery. Rates of all-cause mortality, vascular mortality, hemorrhagic shock, amputation, symptomatic pulmonary embolism, symptomatic DVT, and any proximal VTE were comparable between the two groups. So the future implications of this trial suggest that the use of TXA in non-cardiac surgery reduces bleeding and could help alleviate worldwide blood shortages of blood products. Next, I'd like to talk about the REVERSE-IT trial. Ventrocimab and its impacts on antiplatelet effects of ticagrelor in older people. Ticagrelor is an oral PY12 inhibitor that is effective in patients with acute coronary syndromes, prior myocardial infarction, and high-risk coronary artery disease. As with other antiplatelet agents, spontaneous major bleeding and bleeding associated with urgent or emergent invasive procedures are concerns. The antiplatelet effects of ticagrelor cannot be reversed with platelet transfusion. Therefore, a rapid-acting reversal agent would be very helpful and useful. Ventrocimab is a recombinant monoclonal antibody fragment that binds to free ticagrelor with a high affinity and specificity. This allows ADP to activate platelets while ventrocimab and ticagrelor complex is eliminated from the bloodstream. The investigators reported an interim analysis of phase 3 REVERSE-IT trial, which is a multi-center, open-label, prospective single-arm study of the reversal agent's effects of ticagrelor with ventrocimab in at least 200 patients who present with uncontrolled major life-threatening bleeding or who underwent surgery or invasive procedures. Patients with use of ticagrelor within the prior 3 days who require urgent ticagrelor reversal are ultimately eligible for enrollment. And enrollment is ongoing in North America and Europe. The conclusion of an interim analysis is that compared to placebo, ventrocimab significantly restored platelet function as measured by multiple assays by binding and eliminating free ticagrelor and ticagrelor active metabolite. No thrombotic events or SAEs were reported in volunteers randomized to bentrosimab, confirming the safety profile. And based on this data, bentrosimab appears to be a promising option for ticagrelor reversal. Assessment of bentrosimab's clinical effect with bleeding awaits completion of the REVERSE-IT study. But the ultimate implications of the trial are based on these interim data. Bentrosimab appears to be a very promising option for ticagrelor reversal, and it may be an important drug in the future to have in our armamentarium for patient care. The next trial I'd like to discuss is the Chocolate Touch trial, which was a randomized trial to confirm the safety and effectiveness of the Chocolate Touch paclitaxel coated balloon catheter in above the knee lesions. This was presented on April 4th of 2022. Drug-coated balloons have demonstrated efficacy compared to balloon angioplasty. However, first-generation drug-coated balloons have a number of limitations, and it's been reported these limitations include acute dissection requiring bailout stenting, associated recoil, and minimal acute luminal gain. The Chocolate Touch has a design that may address some of these limitations of the first-generation DCBs. The aim of the study for the investigators was to compare the efficacy and safety of the Chocolate Touch paclitaxel drug-coated balloon to the commercially approved Lutonix drug-coated balloon in an international randomized control trial. Chocolate Touch randomized 313 patients with intermittent claudication or ischemic rest pain, Rutherford category 2 through 4, and angiographic significant superficial femoral and popliteal PAD at 34 centers in the United States, Europe, and New Zealand. In conclusion, in PAD patients, treatment with a second-generation paclitaxel drug-coated balloon led to better target vessel patency and less repeat revascularization in a head-to-head comparison with first-generation DCB. So this has great implications. These results support the safety and efficacy of the Chocolate Touch DCB for the treatment of symptomatic patients with superficial femoral artery disease. And the last trial that I'll be reviewing today in our Clot Chronicles is the Trends in Clinical Characteristics, Management Strategies, and Outcomes in STEMI Patients with COVID-19. And this allowed us to look at reduction of mortality in STEMI patients in a COVID-19 in a vaccine area. And this was presented on April 4th, 2022. We know that the risk of MI doubles within 1 to 2 weeks of receiving a COVID diagnosis. Investigators evaluated data from the North American COVID-19 Myocardial Infarction Registry between 2020 and 2021. For this paper, the researchers analyzed data on 586 patients with STEMI who tested positive for COVID-19 during or within 4 weeks before their index STEMI hospitalization. And the investigators concluded that in-hospital deaths decreased by a relative 25%. And this was thought in large due to the fact that there's a higher availability of COVID vaccinations. In this review and trial, vaccinated patients were less likely to develop respiratory complications, and none of them expired in the hospital. But mortality remained high for unvaccinated patients, around 22% in the data that was reviewed. So the implications are that STEMI outcomes have largely normalized for vaccinated patients. The unvaccinated face risks compounded by COVID-19 symptoms. I hope you've enjoyed the brief recap of late-breaking science from ACC 22. Thank you.